Good morning, everybody, and thank you for that really kind introduction. I also want to qualify by saying I did not name this therapy. I would have given it an easier name. I'm here to talk today about updates for our gene therapy trial looking at telomere elongation for patients with tumor biology disorders. Okay. And as was just said, this is a phase 1, phase 2 trial that is open for patients ages 12 and up. And that designation just changed in the last year. It used to be an adult-only trial. And the FDA, after the first 2 treated adult patients, allowed us to drop the age to age 12. We hope to enroll 12 patients with tumor biology disorders that have mild or moderate bone marrow failure. And this study uses the patient's own blood cells, so their own bone marrow stem cells. We collect them in a standard way that we collect stem cells for patients for bone marrow transplant all the time. And these cells are then treated in the laboratory to elongate the telomeres and then infused back to the patient. This trial does not involve any chemotherapy or radiation, which is different, of course, than standard stem cell transplant. And because you're receiving your own stem cells, the patients or participants do not require immune suppression. This treatment also extends telomeres in a telomerase independent mechanism, and that's important because that means it is usable in patients across the different genetic reasons for having TBDs. It's not gene specific. And then treatment and travel are paid for by the students. So this is an overview in an image of what is involved in participating in the study. And as I mentioned, the bone marrow stem cells are treated in the lab using EXG001. Again, I did not name these things. So this is a viral vector that is used to extend telomeres in the hematopoietic stem cells. And I'll talk a bit more about that in a second. After treatment, these treated cells are then called EXG34217 and returned to patients through an IV infusion. Overall, the patients are in the hospital somewhere between 3 and 7 days for this process. And the blood stem cells are processed on site, and the treatment itself takes of the cells takes 1 day. Follow-up for the study is weekly for the first month, and then monthly for the first 6 months, and then every 3 months out to a year. So in the on the left-hand side there, you see G-CSF fluorophore injection. That is the way we encourage the stem cells to exit the bone marrow space and circulate in the peripheral blood so that we can collect them. These medicines are standard medicines that are used to help those stem cells mobilize and circulate in the peripheral blood in patients every day for stem cell transplant. Standard practice is to use G-CSF. Elixirgen is added for patients where we know it's going to be hard to get the stem cells moving. And we've learned over years of time in other inherited marrow failure syndromes that patients with inherited marrow failure don't like to give up their stem cells. They don't have a lot of them, and they want to keep them. So we have to push a little harder to get them to circulate, and that's what the fluorophore helps us do. But again, we also use that in patients who don't have inherited marrow failure for a variety of reasons who are hard to circulate. The cells are collected through an apheresis machine, which takes blood from the patient, cleans out just the stem cells, and gives the blood back. So there's no blood loss during the process other than the stem cells. And then cells go to the research laboratory, are exposed to the viral vector to elongate the telomeres for 24 hours, off, and then given back to the patient. So I mentioned that EXG001 is a viral vector. What does that mean? This is an RNA virus vector. It's, for those who might be interested, a Sendai virus that has been altered to express a protein called CSCAN4. CSCAN4 is a normal human protein. The body makes it, but it doesn't make it all the time. It makes it during embryogenesis, so when you're being formed in utero. And then it makes it at periodic special time points in adult stem cells. we are using this protein that's normally made in a time period where it normally wouldn't be expressed because it helps elongate telomeres in a telomerase independent fashion. The Sendai virus is not a human pathogen. That means it doesn't make people sick. It doesn't infect humans, and it doesn't integrate into the DNA. And that is different than a lot of historical gene therapies where you may have read in the newspaper about risks of cancer being caused by inserting DNA into places that it wasn't meant to be. There's no insertional activity here, and so that helps decrease the risk in this process. The virus also doesn't replicate, and like I said, it doesn't infect human to human. We do wash the virus off before we reinfuse, but it's also engineered to be temperature sensitive, and this is another safety feature. So the virus is active at room temperature, but it is inactive at human body temperature. So any activity, any production of these antivirals stops once it's infused into the patient, if there's any left in the cells, because the virus is inactivated. And that is important because you don't want continued telomere elongation, because we know that while short telomeres cause problems, super long telomeres cause problems as well. And again, there's no chemotherapy in them. So the hope for this potential therapy is that the treated stem cells will, with the longer telomeres, will have a survival advantage that could help them work better. These cells may improve the bone marrow and blood count problems associated with TBDs. We don't know if that will be the case yet. This is not anticipated to change other TBD-related complications, such as liver and lung disease. And the image here is just to show in non-TBD human stem cells that exposure with the viral vector can increase telomere length. So there's no treatment on the left and longer telomeres there on the right. So this is the first in human clinical trial, which means that the goal of this trial is safety and tolerability, meaning is this a safe treatment and will patients tolerate the treatment? Secondary goals are to see how easy is it to collect stem cells from patients with TBDs. We know historically that has been challenging in the past. Looking at the feasibility of telomere extension, is the treatment doing what we want it to do, extending the telomeres? And then finally, most importantly, looking at, are we changing the blood count issues associated with TBDs over time? So enrollment criteria for this study, and I've highlighted a few of the most important pieces, but of course, as I mentioned before, it's open for ages 12 or up. Mild or moderate bone marrow failure, meaning that you have to have at least some blood count abnormalities, as listed here, including a hypocellular marrow. And this was a requirement by the FDA because they wanted patients to have some potential benefit for being exposed to the risk of participating in a study. And then you have to have a diagnosis of a telomere biology disorder, either with a pathogenic mutation or telomere length less than the first percentile, one of those two things. What might keep patients from being eligible for the study? If you have severe bone marrow failure, this disqualifies you from participation. And partially, and most importantly, because you should be pursuing other therapies for your severe marrow failure. This is not a proven therapy, and this is not a therapy that works quickly. So these patients should be pursuing other alternative therapies, such as stem cell transplant. Also, these patients are much less likely to be able to mobilize or collect stem cells in adequate numbers enough to treat. And I'll talk about that a bit in a second. We also don't want to encourage cells that are misbehaving to grow on. So patients who have changes in their bone marrow that are worrisome for progression to MDS or leukemia are also not eligible for the study. And that does include some of those small somatic mutations that Dr. Olson has talked about. we really don't want to increase risk for patients with participating in the study. If you've had a prior stem cell transplant, that means that your stem cells no longer have a telomere biology disorder, and so you cannot be eligible for the study. And then patients with active treatment for cancer, or those who are on danazol in the last 2 months are not. So enough about what is involved in the study, a bit more about results of the study. I want to emphasize that these are preliminary results, very early days, but we have enrolled and treated 4 patients, including 1 pediatric patient. We've been able to collect enough stem cells and successfully treat those stem cells and reinfuse them into the patient. For infusion, in the stem cells in the laboratory, we have been able to see that the telomeres of those treated cells are longer. There were no acute or long-term side effects in 3 to 48 months, depending on which subject that you're talking about. And we do see in the blood of patients that were treated after the treatment, some cell populations that have longer telomeres. And we would anticipate that we're not going to see every cell have longer telomeres, because some of the stem cells in the bone marrow still were untreated, right? So we have kind of a mixed population. So if you think of the factory, your bone marrow factory, some of the machinery has been repaired, AKA has longer telomeres, but some of it still has the short telomeres. And so the cell populations in your blood, we would expect to be mixed. We did have 2 additional patients enrolled who were unable to collect enough stem cells. So one of the safety features of the study is we don't want to expose you to risk without benefit. And so if, when we give you that GCSF and that Elixirgen, try to kick those stem cells into the peripheral blood and collect them with the apheresis machine, if we don't see enough stem cells circulating, we're not going to move forward. We don't want to put you through the risk of collection and treatment if we don't think you're going to get enough cells to treat. And unfortunately, 2 patients did not meet that criteria. And the study is, of course, ongoing and enrolling. So the first 2 treated patients were recently published, and that's just a picture there from the publication. This study or publication describes the first 4 enrolled patients. So 2 patients who did not move forward with treatment, and 2 patients who did move forward with treatment. The adverse events that occurred were during mobilization. So patients who had mild to moderate bone pain or pain from the line placement that was used to collect the stem cells, and these all self-resolved during the mobilization process. These are common events with mobilization of any kind and not thought to be specific to the study itself. After study drug infusion, there were no acute safety issues that were seen, and the safety profile so far has been excellent. So looking specifically at preliminary data from the paper again, this is 2 months after drug infusion, the first patient. And on the left, you see the patient's telomeres prior to treatment. And so along the x-axis, going horizontally, is length of telomeres. And the normal range is really sort of 6 kilobases, which is the first percentile and higher. And you can see that this first patient, the first patient doesn't really have very many cells that have telomere length in the above the first percentile for treatment. Now, if you look at 2 months after treatment, you start to see that that line is sort of moving upwards, and there are more cells in that area. And that's graphically represented on the far right, where you can see at 24 months post-treatment, in the neutrophil, about 10% of neutrophils show telomere length above the first percentile. Additionally, this patient also shows some improvement in the average absolute neutrophil count, or ANC. Now, the caveat to this is the patient never had a super low neutrophil count. But if you look at the first, or at several years prior to treatment compared to post-treatment, the average neutrophil count in this patient is higher. The hemoglobin and platelet counts remain unchanged. Looking at the second treated patient, very similarly, before treatment there on the left-hand side, you can see that there's very few cells that have telomere length above the first percentile. And I apologize, that says 24 months. It's meant to say 3 months. There are starting to see some cells that have increased telomere length in that patient. So about 5% of neutrophils in the second treated patient have longer neutrophils. This patient actually was on chronic G-CSF therapy prior to treatment and has not required G-CSF therapy since treatment was administered. Again, early days, I said, oh, sorry. That just switched. I said we had 4 treated patients. The other 2 treated patients are just too close to treatment to have results available right now. But from a safety standpoint, the safety signal has remained very good. Happy to take any questions. And